how are you supposed to care for someone else if you're not first caring for yourself?
If I'm happy and I'm confident out like in my own self, I feel like that's going to pour into not only my child's cup, but my daughter.
I'm so excited. The number one podcast in America right now is talking about how important it is for moms to take care of themselves.
Yeah, I love that because that's kind of what our channel has been saying.
Yes, how important, right? We're so glad it's getting a moment on a bigger platform, and like kudos to Allison Kuch and Kylie Kelce for having this conversation. Today, we're going to talk to you about the science behind why it is so important to take care of yourself as a mom and how it can benefit you and your family, and how not taking care of yourself could actually be harmful for your kiddos. I'm Dr. Nichelle Haynes.
I'm Dr. Kristin Lasseter.
Welcome to our channel. We're Medical Mamas.
We explore hormones and mental health from pregnancy to menopause and more.
I didn't know anything about the whole movement of getting your pink back until I think it was 3 months postpartum. And my husband comes home, he has a package in his hand and it's a sweatshirt. And on the sweatshirt, it's like, oh, I'm getting my pink back. And I was like, what? It's just been a fun movement to attach myself to. It's a great excuse to like go out and like be independent outside of your marriage, outside of being a mom, and find what you love doing. For a year, you're pregnant. And then for the year, you're postpartum, and finding yourself outside of that is so healthy, not only for you, but also for your family.
How are you supposed to care for someone else if you're not first caring for yourself?
If I'm happy and I'm confident out like in my own self, I feel like that's going to pour into not only my child's cup, but my daughter. I want her to grow up looking at her mom, like being happy and taking time for herself, because I want Scotty to always take time for herself.
Oh my God, it's so good. It's so good.
Thank y'all so much for saying that.
Yes, it's so important. I think maybe just some context for the getting your pink back would be helpful for people who have not heard about that before.
Yeah.
So essentially, flamingo moms are pink, right? And the pink comes from their food. And so when a flamingo mom is taking care of a baby flamingo, they probably have a special name.
You probably do.
Yeah, whatever. Flamingo kid. Whatever. Flamingo kitten. I don't know. Baby flamingo. It will lose some of its color because it's spending so much of its time taking care of its baby.
And not taking care of itself as much.
Right, exactly. So you can kind of see the health of a flamingo, if they're pink or not. And so getting your pink back is essentially the human version of taking care of yourself and finding yourself. And, just learning who you are in motherhood, because it can be so life-changing.
Absolutely. It can, that whole first few months especially, it can just kind of rob you of yourself. And so I love this about getting your pink back and getting yourself back, and also discovering who you are as a mom.
In this new context.
Now that you have a kid.
Matrescence is the fancy word for that. Yes. Becoming who you are as a mom. I also think it's really cool that her husband was kind of the one who initiated this for her. And it can be really important for caregivers or loved ones to help someone who is newly postpartum.
Yeah, because a lot of times moms feel like, oh, I'm being selfish by taking care of myself, or I don't want to put this burden on my partner to take care of the baby while I go and have a spa day, or while I go and do whatever new hobby I'm interested in. And so the fact that it was coming from her husband, it's like a sign of support of like, hey, I want you to go and like get your pink back.
You, and like ultimate green flag, right? To be so supportive of someone when they're in a period where they struggled. And Allison has been really vocal online about struggling with her mental health in the postpartum period. And she has, talked about medications and how she's supporting herself. She even said in the podcast that she's training for a marathon, which good for you. Like Kylie said, not for me. I'm running from something or towards cookies. So I think that is just so incredible to have support people. And that is evidence-based. The more support that a mom has, or having support can reduce the severity or the possibility of having postpartum depression.
Yeah, absolutely. So a woman's support network, the people that she has around her to help her in that pregnancy and that postpartum time is actually scientifically proven to decrease the risk of her having postpartum mental illness. So the more support she has, the less that risk becomes.
Right. Yes, yes, exactly. So we promised we would talk about how taking care of yourself as a mom is important for you and your family. And I think that starts in pregnancy.
Absolutely. So we know that if a mom is experiencing mental illness symptoms in pregnancy, that has huge risk factors for baby. And what we mean by that is that the risk that can happen to baby can be really detrimental and even life threatening.
So when someone is experiencing depression during pregnancy, there is a higher risk for negative outcomes for the fetus or for the baby. That does not mean it's always going to happen. That does not mean that we're trying to bring in guilt for someone who's experiencing this. We just really want to highlight how it's not something you should like wait it out or just let it go without, receiving some kind of care. That having this information for a lot of people can open the door to receiving care, which can improve outcomes. So that's why we want to talk about it. It's not to make you feel guilty.
Well,
it's not to make anything worse.
And
obviously.
to support the fact that when somebody is taking care of themselves, they are not being selfish in that respect because by actually taking care of yourself, you're taking care of your health and the pregnancy's health. And pregnancy's health is what impacts the baby's health and development when they're a fetus.
So depression specifically during pregnancy increase the risk for preterm birth. It can increase the risk for low birth weight.
Yeah, and I want to say that preterm birth is the highest correlated risk factor for mental illness in pregnancy. And it's not something that we take lightly because preterm birth is also the highest risk factor for infant mortality and for infants going through issues right after birth.
And that's staggering. It's so important to talk about that reducing risk for depression during pregnancy can improve the likelihood that you're going to have a baby.
Or the health outcome of your baby.
Right. It's so, so, so important. We cannot understate it. It is also associated with fetal growth restriction, so maybe being smaller than they would have been if the mom did not experience depression.
And I think in line with that preterm birth, we see higher rates of NICU admission. We also see that babies can have more respiratory distress, meaning a harder time breathing after they're born if mom had mental illness in pregnancy.
But they show kind of in that same realm, greater stress behaviors, specifically cortisol responses. They may have more difficulty with feeding or adjustment.
And they have a lower baseline vagal tone. So what that essentially means, so the vagus nerve, I think a lot of people talk about this with like meditation and breathing exercises. It helps stimulate your vagus nerve. So when you're stimulating a nerve, that means it has higher tone. So in babies whose moms had depression or anxiety in pregnancy, they have lower vagus tone, meaning their vagus nerve isn't as strong, which is something that's stimulated when we're being like calm and in our happy whatever place.
Right. When you're like kind of in that like kind of Zen moment or whatever. Yeah. So they just struggle with being in a calmer body, essentially. So that may mean also that they like maybe a little bit more difficult baby, right?
Yeah,
which can
be more colicky or,
of course, worsen the whole cycle. You have a difficult baby or something like that, and then you're struggling more because baby's struggling more, and then after that, you're doing the whole thing over and over again.
Yeah, and then something I think is just fascinating to me because I love all of this like brain structure stuff is that they've shown that babies' brains who were exposed to mental illness in pregnancy actually have larger amygdalas than babies' brains who were not. And so the amygdala is the part of the brain that's responsible for like your reactivity and kind of being aggressive and like
it's
emotional.
Emotionally charged area, right? So if you're having really strong emotions, your amygdala is like lit up. And if you have a higher volume amygdala, that may mean that you're like a little bit more responsive, or like sort of, I don't want to say explosive, but reactive. Right. Yeah. So that's all during pregnancy, right? That has so much to do with outcomes, right? But postpartum is a longer period of time.
It's a longer period of time, and it's just as important of a period of time for baby's health in terms of, like they're talking about in the video, mom's health and like taking care of yourself, like how that pours into your baby's cup too.
So we don't really have the data around like taking care of yourself makes everything better, right? We don't have that, right? What we do have is we know that mothers or parents who are depressed, their kids are more likely to experience certain things. And if we are taking care of ourselves, then we know that the risk of depression is lower, right? And so that we sort of extrapolate some of that data, right? So depressed caregivers give less responsive caregiving to the child.
And it's not something that is intentional or something that they're even consciously doing. It's just when we are depressed in general, we're just less responsive to the people around us. We're less engaged. And that's part of the illness. That's not somebody being able to control that when they're feeling down.
Right. And so if someone gets depressed and they're responsible for caregiving for someone, it really is more about the duration, right? So if you're depressed for 2 weeks, everything gets cleared up right then, it's not likely to have a very huge response. But if you are depressed for an extended period of time, there's going to be some consistency in those minor moments of less responsive caregiving. And that's the big thing. It's sort of like, drops in the bucket, right?
Yeah. Similarly, like with a big stressful thing happening, like if it's something that's like this one stressful event happened, like maybe it was the election, this stressful thing happened and your stress response or your stress reactivity to that was affected. That's not as big of a deal as if it's you're chronically stressed and overwhelmed throughout this postpartum time.
Right. So it just points to getting care is super important, because then we can reduce the risk of some of these things happening.
Yeah, and setting habits for yourself of making sure that you're getting your needs met in all different ways, right? Like just that's what we mean when we say taking care of yourself.
Yeah, I think that's an important point. We haven't even talked about what that means, to take care of yourself. And in the video that we watched here was a TikTok short that they had posted that I think is really important. But we watched the duration of the total YouTube video, and I didn't see that one specific part. And Kylie was honest and said that they had a lot more conversation than they put in the YouTube video that they put online. But they talked about kind of the things that she's doing. Allison has a podcast for herself. She is kind of doing things that light her up, like bringing sports information to women. She has an Airbnb. She is, running this marathon thing. And there's lots of different ways it seems like she's taking care of herself and finding her interests in the things that kind of light her up and bring her joy.
Yeah, so finding that thing that makes you feel like makes you feel like a person outside of your child and outside of your marriage. Like what defines you, what interests you. And I love when I hear like patients telling me like, oh, I've taken up knitting now, or I started playing the violin again. I'm in a volunteer orchestra. Like just these fun things.
I found a golf club, or, whatever the thing is, that finding the thing that is for you is what's crucial.
Right.
So let's come back to the ways that we know depression in the postpartum period for mom can impact kiddo.
Okay.
So moms who are depressed are less likely to comply with like recommended safety things like car seats, and taking their kiddos to like preventative health appointments, like, well child checks or whatever.
Yeah, I think there was even a study showing that they're less likely to get their kids vaccinated and help them with those preventative health measures.
So that can show up in kiddos like having less social engagement. So if you're a mom, you probably remember this. When kiddos are like right born up until about 2 months, they don't really have a whole lot of social interaction. And around 2 months, generally, is when they start like kind of doing a social smile, where they'll look at you and see you and recognize who you are and smile at you. It is so good. But the kiddos who have depressed moms are maybe doing that a little bit later. They're less likely to. They may do it, a little bit less frequently.
Also, I'm thinking back to like when I had my first baby and how hard it was in that very beginning. And when you're feeling overwhelmed, like you don't want to set up play dates, or you don't want to like go out and interact with other people. And so then also my baby was getting like less social interaction too.
Yeah, exactly. And I think that's totally normal to have that like transition period where you're just trying to figure it out when you're like living on very little sleep. But when moms are depressed, that can be even more impactful.
Yeah, I mean, when depression's lasting, years, that can have a huge impact on the kids' social life too, and their social engagement, and then how to learn about their emotions and emotions of other people, and being attuned to other people's emotions.
And then they're seeing an example in the world of, and Allison kind of commented on this, right? Her daughter Scotty, cute name. Her daughter Scotty gets to see her mom being happy and gets to see her mom taking care of herself. So there's all these nuanced ways in which we are giving examples to our children about, how what it's like to be a grown up in the world. And if they only see an example of a mom who is depressed, then they may not, know how to deal with negative emotions, or they may not, get the example of thriving that they feel like they can aspire to.
Yeah, and I'll give an example of one of my patients who was in a marriage, and this is kind of an extreme example, but she was in a marriage where the partnership just was not healthy for her. She was struggling a lot with a lot of kind of PTSD trauma symptoms and anxiety, and she stayed in it for a really long time because she wanted it to work out, of course, because a lot of people kind of have this belief that you need to stay together for the kids. And eventually she decided she just couldn't take it anymore, filed for divorce, and has now been apart from her husband. And it's been life changing for her. And she's noticed with her kids that they're also more calm and happy. And I thought that was such a perfect example of how modeling for your kids how to make sure that your health, your mental health is a priority, even if it means it might be disrupting something perfect, or the needs of other people. Like ultimately it's important to take care of ourselves and make sure that our own needs are being met. And I think by doing that, she became a more mentally healthy person, and then her kids became more mentally healthy too.
Absolutely. I will actually just say, I don't think that is really that extreme of an example. I see that quite frequently where people are in situations, whether it's work or a marriage or a friendship or really anything that is not working for them, and they make a change towards something that is working for them. everything else gets better.
Yeah.
And that is not extreme. I see it
That's
pretty
true.
much every day.
And I think then a lot of times the thing that keeps them stuck in whatever it is that's, harming their mental health is often because they're thinking, oh, I need to do this for my family, or I need to do this for my kids. And then after they've kind of stepped away from that thing, they're able to see like, oh, this was actually more of a harm to my family and my kids because it was harming me, and you're so important.
Right. I see it every single day that I see patients. When people take care of themselves, so many other things get better. And it just really highlights the importance of this conversation that Kylie and Allison are having on the Not Gonna Lie podcast, just how important it is. More people will hear this, and I guarantee you someone will get care because they're like, oh, these people do it. I can do it too.
Yeah.
And I mean, that's just the thing that we have said from the very beginning of starting this channel is it's so important to take care of yourself. We want you to have the information about taking care of yourself in a meaningful way and why that is so important and how to do it.
And why it's not selfish.
Right. It benefits everyone else. It's not selfish. It's not selfish. Yes. It's so important. We're so grateful that they are having this conversation on such a big stage.
Yeah. I just think also pointing out that like extending that conversation to mental illness in general. And if you are suffering from mental illness, this is why it's so important to get treatment. And treatment can be a number of different things. It doesn't always necessarily have to be medication. It can, we have all these videos on the different types of treatment. But the point being that if you're suffering from mental health or mental illness in pregnancy or postpartum, don't wait it out and make sure that you're taking care of yourself, because ultimately that's what's best for your baby. And we know that moms care a lot about wanting their baby to be healthy and happy.
We also would really love it if you would comment if there's anything that you have to add to this conversation. Share your story. Use the example of bringing this information to light because it will help someone. So share your story about, I got treatment, everybody benefited. We would love to really solidify that message.
Or also share like what your hobbies are, because I have a lot of patients who are like, I don't know what I enjoy doing. I can't even think of like hobbies to do anymore. And so it can be helpful to hear what other people's hobbies are and be like, okay, I
could try that. That's great, because I actually struggle with that myself because I'm very passionate in this realm and I want to spend a lot of my time doing it, but I do need something that's for me. And I like reading, but I don't have a whole lot of other things that I like to do. Yeah, please, if not for them, for me. Thank you so much for being here. Please give us your comments and subscribe.
Bye.